Now, Ghana's MPOX case count has risen to 218 after the Ghana Health Service confirmed 21 new cases. In the Ahafo region, one confirmed case has been recorded. There are also 12 suspected cases, prompting an urgent response from the Regional Health Directorate and the Regional Coordinating Council. They join us for a conversation, and this morning I have with me Alfred Abuaje, PRO of the Ahafo Regional Coordinating Council, joining us on this MPOX conversation. We're grateful for your time, Mr. Abuaje.
Thank you for having me.
So briefly explain to us what the situation is in your region.
Yeah, as you just stated, it's true that a case has been reported with regard to the MPOX, and the Regional Health Directorate was in the office of the Regional Minister to brief her about the situation, what we've done so far about it, some of the individuals who have had contact with individuals who had the disease, who are still being traced, and the necessary medical treatment being applied to them. And so what the minister did was that immediately she sent a message to the various health directories and the directors and the health institutions and the education directories and the health education institutions in the various constituencies for the purposes of sensitizing the individuals who are within their care so they can take precautionary measures in order to prevent the disease from being spread to other areas. And so far, it is true, yes, a case has been reported here. Certain individuals who had contact with the individual who had the disease the process is going on to get them raised, identified, and then the necessary medical procedure be applied to them.
So specifically, which areas in the region have recorded cases?
Yeah, it's in the regional capital, which is Goso, which is within the Asunafo North constituency.
And in the contact tracing, do we know where this person contracted it from?
Actually, the health directorate, she was briefing the regional minister in the meeting, actually did not make that point. So when I was invited by your correspondent to speak on this issue, I tried to reach up to her so that she can give me specific matters as you just mentioned, but I couldn't get her. But the most important thing is that a case has been recorded in the Ahafo region, and so it is incumbent on each individual to be careful about how they go about their daily activities.
So what's interesting is this, we usually hear that the cases are steadily rising. Until today, we didn't know specifically which areas, with the exception of Goso right now. But how then are we ensuring that people are adhering to certain protocols as not to spread this disease? Because since it started, it's gradually escalating. What measures have been put in place to prevent a full-blown infection?
Yes, thank you very much. As I said earlier on, the regional minister has directed directors of the health facilities in the various constituencies, and then to the MDCs in the various constituencies, and then to the head of education in the various constituencies to engage in an effective and proactive sensitization and education to the people who are under their influence so that they can take into consideration the precautionary measures such as washing of hands with running water and then soap, and then also making sure that food that you eat, especially bush meat that are being consumed, will be properly boiled. And so touching people, just like the most important, the regional minister said they should go back to the precautionary measures that were put in place during the COVID-19. It's the measures just as was given to the Ghanaian people during the episode of the COVID-19 are the same measures that the regional minister encouraged the various health institutions to educate the people under their influence to abide by. So it's almost like nothing new was being told them, just like the precautionary measures that was taken during the COVID-19 episode are the same measures that individuals are supposed to go to. And then also, information was given to the immigration officials to tighten border surveillance, or if you like, border control, to make sure that people who enter inside do not show signs of the MPOX. And so, therefore, if they're able to identify anybody who shows signs of MPOX, immediate medical attention should be given to the individual.
Right.
To be responded.
Right. Thank you very much for that update there. Meanwhile, government has released more than 460 million Ghana cedis to the Ministry of Health to support the training allowances of 120,000 nursing students across the country. This payment covers a 6-month period. And according to the ministry, there's a statement that's coming from there, and it says it can confirm that an amount of 462 million has been disbursed to support the training allowances of 120,000 nursing students. And the payment, which covers a 6-month period, forms part of a broader initiative by government to provide financial support to students in nursing training colleges. The allowance, which was a key commitment made by His Excellency John Dramani Mahama during the recent electioneering campaign, has now been fulfilled, with payments scheduled from today and continue until today, as in it started yesterday. Now.